Self-insured employer plans are not actually required to cover any specific mental health and substance use disorder benefits, but many do provide those benefits. The employer's human resources department or the benefit materials can explain what benefits are covered by the health insurance plan. If the plan does provide mental health and substance use disorder treatment benefits, those benefits must be the same as physical health benefits in terms of what you pay, co-pays, co-insurance, deductibles, and out-of-pocket maximums, how much treatment you can get, such as limits on the number of visits that are covered, the use of management tools, such as prior authorization requirements, which doctors you can see, including coverage for out-of-network providers, or the criteria and process the insurance company uses to determine what's medically necessary. It can be difficult to know if health insurance companies are treating mental health and substance use disorder services similar to services provided for physical health. Here are some questions to consider. Is there a higher copay for a behavioral health service than a physical health service? Are there limits on how many times the patient can see a behavioral health provider, but no limits or different limits on how many times the patient can see a physical health provider? Is permission needed from the plan administrator to access behavioral health services, but not for physical health services? Does the plan allow the patient to see an out-of-network doctor for physical services, but not for behavioral health services? Is the employer or plan administrator refusing to pay for behavioral health services even after a doctor says these services are needed? Does the employer or plan administrator require the patient to try outpatient behavioral health services before it will pay for inpatient behavioral health care? Has the employer or plan administrator refused to pay for substance use disorder treatment in a residential treatment facility because it said it wasn't medically necessary? These warning signs can help identify possible violations that could result in a complaint being filed. If it seems an employer or plan administrator is making it more difficult for the individual to access mental health and substance use disorder benefits, contact the United States Department of Labor's Employee Benefits Security Administration, or EBSA, for private sector employer plans, or the Department of Health and Human Services Centers for Medicare and Medicaid Services for public sector employer plans. Pennsylvanians can visit the EBSA website or call the EBSA regional office in Philadelphia or the main office in Baltimore, Maryland.